That's a little loud. Thanks everyone for coming today, and I hope you've enjoyed the last 2 days worth of panels on Social Security and Medicare. This last session is going to focus mainly on millennials and on how we pay for all these things, how we pay for the growing costs of Medicare and Medicaid. So real quickly, well, first of all, I'm Marc Goldwein, a longtime member, first-time speaker at the NASI annual conference. I work for a group called the Committee for Responsible Federal Budget. We support responsible federal budgeting, surprisingly. I want to quickly fast forward to the year 2050. That's when people that are in their 20s or 30s now are going to be in their 60s or early 70s. In 2050, we're going to have debt, if we keep doing what we're doing, about 170% of GDP. If you looked at that in real dollars, which as an economist you should never do. I'm sorry, if you look at that in current dollars, in dollars in 2050, that'd be $140 trillion of debt. When we look at these, I would strive in that, it's the growth of Social Security, Medicare, and Medicaid, and the lack of revenue to keep up with that growth. Social Security, by 2050, will only be able to fund about 3/4 of the scheduled benefits. In other words, in today's dollars, Social Security benefits should be about $25,000 a year for the average person. Instead, if we just let things happen as they're scheduled, in other words, the trust fund runs out and we have to cut benefits across the board or mail out checks late, the average annual benefit will be $19,000 instead of $25,000. Alternatively, we could solve that problem by raising the payroll tax. If we wanted to close that gap on the payroll tax, we'd have to raise it 3.8%. That'd be, instead of paying $9,000 in today's dollars in taxes, the average person would have to pay $11,500 just in Social Security payroll taxes. We could, of course, not cut benefits across the board or not raise taxes across the board. There's plenty of options to decide who pays more, who gets less. But I'd point out, if we raised the taxable maximum to infinity, we got rid of the whole taxable maximum, that would only close half the gap in 2050. So this is a sizable gap that we have to close. That's the easy part, Social Security. We also have the Medicare program. Medicare Part A hospital insurance is only going to be able to cover 2/3 of it costs, and that's assuming a lot of things in the Affordable Care Act happen as we hope they will. It could be even worse, and some of the trustees and actuaries think it will be even worse. That means we either need big Medicare tax increases, big increases in general revenue, or reductions in health spending. When we look more broadly at the budget, there's a lot of choices that have to be made. What kind of Social Security system do we want to have? What kind of healthcare system do we want to have? And how are we going to finance it? Are we going to do it by cutting back on these systems relative to the services provided today? Are we going to do it by raising taxes? Or are we going to do it by cutting spending elsewhere in the budget? Probably it'll be some combination, but the how matters a lot. And those that are going to be stuck with the burden are mainly the people aged 20 to 40 right now and younger. And that brings us to this discussion. How do millennials want to finance the welfare system? How do millennials want to finance the social insurance system? And what are they willing to pay for? To sort of launch that discussion, we have two distinguished panelists with us today. Their full bios are in your book, so I'm not going to read everything. But right to my left is Hilary Doe, who's a senior advisor at the Roosevelt Institute. She's also currently pursuing her PhD in politics at Princeton. Hilary was named in 2011 one of the top 30 under 30 civic leaders and has been a member of NASI since 2011. To her left, we have Brian Collins, who's a policy analyst at the Bipartisan Policy Center in their economic policy program, where he works with the Dimitri-Rivlin Task Force and has done a lot of analysis on debt-related issues. In the past, he's worked on a number of political campaigns, including Congressman DeFazio's re-election campaign in 2010, as well as for an association called eHealth Initiative. We'll kick it off with Hilary, and each of these guys will speak for 10 to 12 minutes, and then we'll take some questions.
Great. Hi, everybody. Thank you, Marc. Good to be with you guys again. For those of you who have been to this event in the past, I have too. So good to see some of you for the second time. So I took this panel to mean not only sort of how, the nitty-gritty of how we can pay for different things, right, but what, in fact, it is that this generation is interested in paying for, what types of program expansions we want to support, are there cuts that we want to support, that sort of thing. And I wanted to frame the whole talk with around 3 questions. So, do young Americans support social insurance programs? Yes. would be my answer to that, and I can talk a little bit more about that. Do young Americans struggle to make sense of the conflicting messages that they receive from campaigns targeted directly at the generation about social insurance programs? Absolutely. Happy to talk about what some of that struggle looks like. And is the generation prepared to tackle the policy, political, and ideological challenges to our social insurance system that we face? I think so. I think so. But I'm going to talk about that a little bit too. So over the past few years, the Roosevelt Institute has worked to engage young Americans nationwide through our campus network around the issues that face the country broad, from the economic issues, healthcare issues, homelessness, local challenges, all the way to national challenges. And it's specifically focused on social insurance and the Social Security program, Medicare program over the last few years through our Think 2040 series. Think 2040 was a program that asked young people what they want the country to look like in the year 2040. What kind of future do they want to inherit as Americans? And then asked them to design kind of a blueprint for the Millennial America. What are the key things that we care about? How are we going to pay for them? What do we want to invest in? Went so far as to make a comprehensive federal budget that we had scored CBO style to prove that we could make the kinds of investments that we wanted to make. And then this year, the Campus Network kicked off a new program called Government Buy-in for the Millennial America to explore how to use government as an innovator, as a source of change, how to be entrepreneurial inside the government in order to make these kind of changes that they supported. And overwhelmingly in those conversations, young people expressed support for social insurance programs. They're within the realm of young people's core values. This generation, the largest ever in American history, is really civically minded. They're community-oriented, socially empathetic, care a lot about the promise of Social Security as a foundation of the social safety net, and think really creatively and holistically about social insurance programs. Those of you who have heard me speak before might have heard me say this, but the term that was coined through this process when talking about the social safety net in 2040 by our students was social safety trampoline. They didn't want just a net that could catch people at the bottom, but thought creatively about a social safety net that was flexible and responsive, that responded to changes in economic downturns, that had Social Security as a core, as a foundation, but also included, broader expansions, the student benefit extension as an example. Like I said, a responsive safety net that had auto stimulus, state banks, preventative care as a part of what we think of as the social safety net. So that sort of creative orientation towards the social safety net was really appealing. So these programs are in line with millennial values. The second thing I'll say is that the messages that young people respond to with regards to Social Security, they respond much better to messages that are pro-social insurance than those that are anti-social insurance. So I alluded earlier to some of the sort of campaigns that have targeted young people in order to try to convince young people that Social Security won't be there for them, that sort of thing. You guys are aware of these kind of campaigns. And there have been some on both sides. But the messages about Social Security not being there are really sort of self-directed, so about self-preservation. They're about individuals, whereas messages about social insurance are inherently sort of more appeals to being an American, to these it's identity politics, for those of you who are familiar with that. And American identity, identity with one's racial group, with one's class group, intergenerational messages, things like that are just stronger, play better with millennials, are more appealing, and young people support those messages more than they support sort of self-directed messages. So our messaging is good if we support social insurance programs. And then thirdly, young people are motivated to engage with these challenges. But I will say that the lack of ability or seeming the ease with which one can create reforms in this space is definitely the biggest hurdle to young people supporting social insurance programs. They seem kind of difficult to deal with and to change and to reform. They seem big and bureaucratic and hard to move around. And so I think that is the biggest hurdle. I don't know if anyone here today is from the Frances Perkins Center. Is anybody here? No? Sometimes they are. All right. Frances Perkins Center gives an award every year, and I often think about it in the context of this conversation. It's called their Open Door Award. someone close to Frances Perkins, her mother maybe, I don't remember, said to her, when a door opens, you must go through it. And that apparently motivated her whole life. And that requires courageousness. If you don't know what's on the other side of the door, but you must go through it. And I see that kind of courageousness in this generation, in young people, when they talk about social insurance reforms. There's like an ambition to tackle these challenges, even though they're big and difficult. And I see that. But I think it's our responsibility, if their goal is to create this vision for America with this expanded social safety net and make some of the difficult changes and reforms that need to be made in order to have a fiscally solvent, strong America with these kind of reforms. It's our responsibility, I think, to remind them that FDR said government is ourselves and that it's true. That we can create these changes if we want to, believe in the democratic process again. Only 30% of young people think they're represented in the democratic process. It's important for us to remind them that these changes are possible, I think, because that is, I think, the biggest hurdle, and the biggest hurdle that we've seen. There are programs like Government Buy-in For, and some of those that you all run, NASI's Academy program, wonderful, for internship program. At really instilling those, reminding people of those values, because these programs do seem big and immovable, but they absolutely are. So when the next time you hear someone say Social Security won't be there for me, remind them that it will be if they want it to be, and it won't be if they don't. These things, have to be fought for. But all to say that sort of the bottom three things about Social Security are that young people right now, I would say, by and large, absolutely do support these programs and are willing to do the things necessary to pay for them and to pay for expansions. So, for example, they support increasing the cap. We've seen that's the case in order to pay for student benefit extensions and expanded benefits. Like I said, they support sort of a creative perspective on the social safety net that includes auto stimulus and state banks and all these other things. So when you're messaging about Social Security, Medicare, you don't have to talk about it in silos, but sort of more holistically. Appeals to broad identities that are strong, like American identity, as opposed to intergenerational warfare, win out every time. Those are appealing to young people. And that we have to just continue to remind young people that these things they want to accomplish are absolutely possible. They're the largest generation in American history. We've done it before. We can do it again. I think those kinds of appeals from people like you who have been in the field for a long time and who can help to support another generation of real soldiers for Social Security in the coming battles that are going to be hard, making the choices that are going to be difficult with regards to budget will be really important.
Brian?
Cool. Well, thanks. My name is Brian Collins. I'm with Bipartisan Policy Center, and just a little bit about kind of what we're doing at BPC right now. We've brought together kind of the budget side, the Domenici-Rivlin Deficit Reduction Task Force, and the staff that worked on that, and former Senator Domenici and former Budget Director Dr. Alice Rivlin, with our health project, which is led by former Senate Majority Leaders Bill Frist and Tom Daschle. So we've been working on a series of cost containment recommendations that have a system-wide focus that we'll be releasing in a couple of months. But to this session, shortly after last November's election, Ron Brownstein of National Journal wrote a column that I thought was striking, and he led off with the following words. He said, "There was no exit sign, no milepost, but in this week's election, America unmistakably turned onto the road of sustained competition and conflict between the brown and the gray." So what was he talking about? He was predicting years, decades really, of intergenerational conflict between the politically influential boomer generation trying to enter retirement and my ethnically and culturally diverse millennial generation trying to enter and succeed in the workforce. Brownstein cited exit polls that showed mirror opposite voting patterns and attitudes, with 3/5 of voters under 30 going for Obama and 3/5 of whites over 45 going for Romney, along with attendant very different views on social issues and many other things. And he added, and I quote, "The aging white population has grown increasingly resistant to taxes and dubious of public spending on anything except the Social Security and Medicare programs that directly benefit them," end quote. So that's a very stark stark observation, and if what he's saying is true, then I think it's predictive of some really difficult times. But I also think that those results were reflective of a lot of rhetoric in the past election that was extremely divisive about cuts to Medicare that happened on both sides, and whether those cuts were being used to fund health insurance for somebody else. And it was the perfect setup to have intergenerational conflict. I'm not convinced that it has to be that way for the long term. And other people have done groups, in the context of political polls and exit polls, you get one set of attitudes. But if you actually sit down with people from a community around the table and talk about the great issues we face, sometimes you get a lot more nuanced opinions. And the Kettering Foundation has been doing that over the last year and a half or so, all over the country, red states, blue states, big cities, small towns. And they found participants from all walks of life are quite come to these difficult issues we have with our federal budget and health care and Social Security with a much more open mind, that people are not totally self-interested, that older Americans are very concerned about what is happening to younger Americans, what sort of debt is being left to the millennial generation, what effect the economy is having on people who are barely hanging on to a middle-class lifestyle. So I think the context matters a lot, and that's how I want to lead into my answer about, can social insurance address the needs of increasingly diverse generations? If so, what should be done to reach out to younger Americans and engage them in charting the future of Social Security, Medicare, and other social insurance programs? And I think certainly, yes, social insurance can address the needs of the new and diverse generations. But I suspect the way to engage young Americans in the issues with Medicare and Social Security are not to ask young Americans how they feel about Medicare and Social Security. I think that we have to change and broaden the context. So I think when we're all together in DC, it's always really good to remind ourselves, and I try and remind myself a lot of this, of what most young people today are experiencing right now. The three of us on this panel, we're all lucky to have really wonderful jobs and the opportunity to participate in these issues. But a lot of 18 to 35-year-olds are very worried about finding a job, finding a full-time job in the field that they're interested in that will put them on track for their career, finding a job with a good enough salary to pay their student loans, finding a job that has benefits. If I have a job, will I be able to keep it, or will I be caught in these cycles of layoffs where the newest employees are always let go and I'm not able to develop really a track record and develop mentors and all the things that are important to a career? So Medicare and Social Security are often the farthest things from the mind of many young people today who are struggling in this economy. But what if we change the context, and instead of asking young people about Medicare, what if we engage with young people about health care? And how do we make their experience accessing health care better? And certainly young people don't have as many health care needs as older Americans on average, but we do have some, and we all have interactions with the health care system. Many of us will be affected by the changes that are underway, like insurance exchanges going live in October and staying on parents' insurance plans and no additional charge preventive services. And a lot of people will be getting coverage, but many of those who do have coverage, and when I talk to people my age about their experiences with the healthcare system, I hear lots of frustration. I hear people who are concerned about rushed doctor visits where their questions don't get answered. People who are frustrated they can't email their doctor. I just can't emphasize how big of a deal that is to many young people, that we use technology to talk to our friends, to our colleagues, to work with other businesses we have a relationship with, some of which are only online, like Living Social and so forth. And pretty much the only professional who won't answer your email or let you book appointments online is the doctor. And we're truly amazed when we have interactions with the healthcare system where providers lose records because the fax didn't show up, mostly because we're amazed anybody's using a fax machine. And so the problems I talked about, this poor patient experience, they're not just young people problems. They're problems seniors face, that Medicare beneficiaries face. I mean, here in Washington, I've talked to 80-year-olds who are frustrated that they have to make an appointment to go into a 10-minute office visit with a doctor when they're pretty sure that their issue could be resolved over the phone. And all of this is reflective of the payment system. The way Medicare pays for care influences the delivery system for those of us with private insurance because we're young. And there's no way that we're going to be able to fix the experience that we all have, young and old, without fixing that fee-for-service payment and the reflective delivery system. And Medicare is a key part of that. So if we're going to fix the system, we can't just have seniors only caring about Medicare and have young people only caring about, the Affordable Care Act and the exchanges and the Medicaid expansion and our private insurance from employers. And there was a comment in the earlier panel that, well, Medicare beneficiaries are just like, pharmaceutical companies, and they're just focusing on they're fighting for their own benefits. And I really hope that that's not true, because if that is true, I think that Ron Brownstein will be right, and we're going to have 3 decades of really, really bitter political wars, and once my generation's big enough in numbers, you can say goodbye to your benefits. I really hope what's true is that people are citizens, and I believe that that's what's true, and that certainly they have to care about themselves, but also care about who's coming next and who's older than them, and how we all fit in this together, and that we can find solutions that maybe aren't always in each of our short-term self-interest, but are in all of us together as long-term self-interest. And it's true with retirement as well. I don't want to leave out Social Security, that certainly most young people not very worried about retirement, but a lot of us have 401k plans. A lot of us, if we're lucky enough to have a job with benefits. And there are a lot of problems with the retirement system. Many of the people I know, young folks have, they get laid off from jobs and don't have savings and have to tap those accounts. And interestingly enough, that's a huge problem with a lot of my friends' parents who are boomers who have lost their jobs and have had trouble finding a new one and have to tap those accounts. And a dysfunctional retirement system at these stages, just means more people who will only have Social Security when they're retired. And so we all need to work together to solve these problems. They're very difficult, but we all have things that we can bring to the table, and we all have experience that can inform a better system. So I hope that we'll change the context, we'll look at these holistically, and that we'll work together and try to find solutions that can make a better America for everyone. So move on to, thank you.
Thanks, Brian. So, Hilary, had I known about your initiative, I would have fast-forwarded to 2040 instead of 2050.
Yeah, I know, I was wondering. I'm in the past.
So, yeah, I guess so. Let me first ask this question to both of you, but especially you, Hilary, since I know you spent a lot of time looking at polling. How have you observed millennials' views changing on social insurance and related issues pre- and post-economic crisis? Or what impact has the financial crisis had on millennial?
So the short answer, I think, is that support for social insurance programs has actually increased post the crisis, which makes sense if you think about wanting insurance against instability and things like that, but doesn't make sense if you look at the rhetoric. There's been heightened rhetoric about this whole Social Security won't be there for you kind of narrative. So I think despite that, we've seen support for social insurance programs increase. Again, though, I'm speaking about social insurance broadly. So in the context of, insurance against lots of different crises. Think about it, right? So someone my age has already lived through 2 recessions, Hurricane Katrina, 9/11, just lots of shocks, more than maybe folks who grew up in the early 90s. So I think that there's this sense of sort of social empathy and collective consciousness. It's important to insure against these things and to support each other. Like I said, appeals to broad identities really are important and useful. So we've seen that happen, but in the context of these broad definitions, not necessarily on specific policy details where rhetoric might win the day.
Yeah, and I'm not nearly as familiar with the polling as Hilary is, but certainly a lot of young people, their first experience with social insurance has been unemployment insurance, and that's been very critical, and I think certainly a lot of the people I know have appreciated it greatly. Of course, it doesn't help people who haven't found a job out of college for the first place, and I think it also, definitely the age of the program in terms of built for an era where people supposedly could find a job quickly, moving into traditional jobs as opposed to trying to start your own business or be a consultant, which a lot of young people are trying to do. And UI has not necessarily, some states have done some innovative things in that area to try and help people do that, although I don't think we've moved as fast as we can. The other thing it doesn't address, which fortunately is going to start getting addressed next January, is access to health insurance. That it can be very, very hard, you know, if you get laid off and you think, gosh, I want to start doing something on my own, it can be very hard to get health insurance coverage as an individual, sometimes at any price, and fortunately that will be changing in less than 12 months.
Just one more quick thing on Social
Sure.
Security, actually. Another experience that young people have if they are lucky enough to get a job, which is usually not paid at the rate that they would normally be paid because they're taking, you know, part-time employment or whatever it is in this case because of the high unemployment rates. They have to make that decision whether or not they want to start receiving retirement, you know, to saving for retirement. They have to decide if they're going to do that or not. And so many of my friends said, I can't spare it. I can't spare that extra. And then when you talk to young people about Social Security, if you are silly enough to use the three-legged stool analogy, which like doesn't exist because there are maybe two legs at this point, that has been really salient to young people when they're talking about Social Security because they realize, okay, so pensions are gone, my stool's wobbly, and I can't afford to put away any money in retirement, so I got one stool or one leg on this stool, and if we cut Social Security, I'm sitting on the ground. You know, so I think people recognize that those things are, you know, getting chopped out from under them, quite literally. And so you start to engage in Social Security, I think, when you start to make those decisions about retirement plans as well.
Thanks. So this panel is called No Benefits If They Won't Pay for Them, What Young Americans Are Willing to Finance. And, you know, as a fiscal conservative, I'm going to ask some questions about how we're going to finance things. Hilary, you talked about how you found that young people are willing to make some of the hard choices. Brian, you talked some about how you all are working on some healthcare stuff, and I'm not going to make you give away your secret sauce. But at first, well, the report's coming out next month. I'm sure he'll plug it when I give Brian the opportunity. So the first question I'd ask is, what types of hard choices are millennials willing to make, and what types of choices should they be making? And I'm going to ask a follow-up, which is a little more leading, which is, granted, a choice being harder doesn't make it a better choice, but what in that subcategory are actually hard choices, meaning they affect more than, say, 5% of the population?
That is leading.
Yes.
I see where you're going there, Mark. Do you want to go, or do you want me to start?
Gosh, I need to think for a moment.
Well, I'll just spitball. So I mentioned one that is pretty common, and it leads into your second point, which is, of course, that there was support among millennials for raising the cap so that we can make social insurance or Social Security solvent for a longer period of time, and also continue to provide benefits or expand benefits. And I think that there's, sure, that affects a smaller percentage of the population, to your point, but I think that there's a sense of this, if we believe that we're all buying in, we should all buy in at, like, you know, a rate that feels the same to everybody. There's a sense of fairness there that we heard from millennials, so I think that was part of it. That's one of the things. Also, in the context of healthcare, like I said, since young people are really supportive of sort of thinking about these things holistically, preventative care and things like that were definitely part of the calculus. You guys, if you want to, can and should, I think, check out the Roosevelt Campus Network's budget for the Millennial America. It goes into really fine detail about sort of healthcare reforms that we can make, ways to tackle some of these budget challenges. I'd say out of the whole budget, we tackled things, you know, from environmental policy to, like I said, sort of homelessness, state banks, all of these things. I'd say that the hardest working group, the most difficult conversations happened in the healthcare working groups, and Adam, who's here in the front table, you can raise your hand, Adam, was a key player in that working group, and I'm sure can answer in more granular detail what some of the hardest decisions were there. But all of it's played out in that budget, and they ended up with a budget, or with bundled payments, talking about that, and some sort of hybrid healthcare system. It wasn't full single payer. All to say that, you know, that was definitely the most difficult area where we're really going to struggle, I think, as a generation, because there were real divides, whereas in other areas there was sweeping support for change.
So I'll first start by saying that I couldn't begin to say what young people are willing to finance. So I'll set that part of the question aside. But in terms of the kinds of hard choices that I think people are going to need to make, I don't know if young people will be willing to support them. First, I would define hard choices as choices that will affect, if not a majority, at least a very large plurality of Americans. So, you know, raising taxes on people who make more than $400,000 a year. I mean, I understand that apparently $400,000 is not a lot in some cities in America. Where I come from, it's a lot, and it's not asking for most people to experience change. So I'll kind of restrict my comments to ones that I think affect most people. I think on the retirement side, I think the hard choices are going to involve fairly dramatic change to the pension system that will involve, you know, if we want to have a leg to the stool other than Social Security, we have to start talking about should people be required to save money, as they are in countries like Australia? And should people have any access to those retirement accounts until they are, say, 62 or 65 at all? Should people be able to borrow off, you know, short of access to those retirement accounts, borrow on the value of their retirement accounts? So fairly dramatic changes there that should, as part of a forced savings program, should people be able to invest that in absolutely anything they want, in IRAs or 401ks? Should there be guidelines there? You know, how much choice can people have if we want a system that is truly going to work and where people aren't going to, you know, get to retirement with, you know, $30,000 in savings, which won't go for very long. I think we have to look at changes to the tax code that will affect almost everyone, like fewer tax preferences, for instance, for health care, and other things that are designed to focus people on being more conscious about, you know, the value that they're getting for what they're spending. I think another hard choice is asking people to take more responsibility for cost and be more engaged in the health care that they receive. That may mean that if you want a choice of any provider, you have to pay a lot more. If you want to go outside efficient provider networks. So I think the hard choices involve really engaging everyone in decisions about healthcare and retirement, and insisting that everybody participate. And, you know, I mean, Tim talked a lot in the last panel about how we can't get rid of supplemental coverage for Medicare for anybody who's already in the program. And there are a lot of people who have Medicare who pay absolutely nothing when they go to see the doctor or go to the hospital. And I think if you told a young person about a health care plan that had no copays or no deductibles or anything, I think they would think that that was a dream world in another universe that doesn't exist. And so I think the hard choices involve moving beyond this idea that we can grandfather everybody from any sort of change during their lifetime. And I believe that most people are capable of change. I think it has to be reasonable, it has to be doable. And I think we have to stop assuming that all the hard choices lead to worse outcomes. Some of these can lead to a much better experience for all of us. And that's why I really wish that we would move the conversation beyond, do we want reductions in Medicare and Social Security, to how do we make these better? How do we make it better for everyone?
Thank you. Well, I've monopolized enough question time, so if others have questions, there's a microphone right here and right here. If you're unable to get up to the microphones, raise your hand and someone will come around with a portable. I will remind everyone, please keep these questions, not statements, so we have more time for additional questions and for answers. Thank you.
There's somebody there.
Gary Franklin from Washington. I think a lot about the young people that were part of the Occupy movement, and a lot of disaffected young people for a lot of the reasons you've mentioned. And I'm wondering if there's any knowledge or what you think of how that energy can be captured and to help all of us move this stuff forward.
It was amazing to be sort of present for part of the Occupy movement. Roosevelt's headquartered in New York, so we were really kind of able to be on the ground floor there and participate in some of that, because there is a lot of energy. And you're right to say that there's this sense of like disaffectedness among some of that population. But one movement that's really cool that has been, I think, really amplified by Occupy, and that is continuing, is this participatory sort of budgeting movement and the participatory sort of community conversation movement that's been happening. And some of you may have been a part of some of these conversations. But they allow people, large numbers of people, supported by technology and social media and all of that, to have really substantive participatory conversations about what they sort of want the future to look like, what policies they support, things like that, that can really get us further into talking about, like, changing the public dialogue about interesting solutions, changing, as you were saying, kind of breaking out of this narrow box that is inside the Beltway sometimes around the things that are possible and defining new possibilities. At the time when we did it in 2011, the Campus Network's budgeting, or Budget for the Millennial America, was the largest participatory budgeting experiment that sort of had ever happened, and we didn't know if it would work. But it was very cool to ultimately get 3,000 young people across the country to deal with and build a comprehensive federal budget that was scored. Like, I didn't think before we started that, I'm not usually a naysayer, I'm an optimist, but I did not think that we could get 3,000 college students to spend a lot of their time crunching numbers to build a federal budget. Call me crazy. And I was crazy. I mean, they did, the people came out of the woodwork to do that, and we're certainly not the only ones that are doing this stuff. And if we think about the ways that sort of the new technology environment can be supportive of and not distract from our ability to participate as citizens, I think the participatory movement is a really great one. And the more that we can insert sort of outside perspectives in mass into these important conversations within the district, I think the better.
Yeah, I thought the Occupy movement was really cool, and one of my favorite things about it was hearing all kinds of sort of unexpected people, like the president of the Federal Reserve Bank of Dallas saying, actually, I kind of see where they're coming from. If I were a young person who couldn't get a job, I'd probably be out there too. And so I think it's important to be able to get out there and remind people that people are hurting. And what I'd say to people who are involved in that movement is that, but you can't stop there. Mm-hmm. You've got to get involved, work on a political campaign, or go to a town hall, or write letters, or be involved with a not-for-profit, or do something to also further your values. And what I'd say to boomers, and so, I know some of the Occupy supporters were boomers, but for those who weren't involved in those protests, is something you can do is provide opportunities for young people to serve on committees, or work on projects together, or whatnot, and so build those linkages and serve as a mentor. And I think that that's how we create change that is lasting and sustainable.
And specifically about social insurance, just to build on that, those opportunities that you provide, to the extent that they can be substantive and invite creative participation, I already said that, the better. I just think that one of the challenges that we face when we talk about Social Security, Medicare, Medicaid, is we come to it with a defensive posture. Like, this is a program that we think is important and that we want to protect. So, like, sort of hands off this, and we want soldiers among the young people to help us defend it, to defend the fort. And I think that can't be the posture. It's not inviting, really. And I think it doesn't appeal to those people who feel kind of disaffected. If you want to participate substantively, give them an opportunity to innovate a little, to be creative with you, to have a conversation that is flexible, where they can see their impact, and to build a new vision for something, right? So, proactive posture around these programs.
Thanks. So I failed a little bit of my moderator duties, and then I forgot to ask everyone if you could identify your name and what organization you're from. Appreciate it.
Anna Rappaport, Chair, Society of Actuaries Committee on Post-Retirement Needs and Risks. When we're going to change something, often, if it doesn't quite allocate things well, the change would involve having winners and losers. And there historically seems to be a great reluctance. The minute you say there are some losers, you've sort of frozen the conversation lots of times. I wonder if you all have suggestions from a different perspective how to make winners and losers situations work, and whether you have any thought about that. Isn't that something we really need to be able to accept?
Yeah, I think it is. Sorry, did I cut you off? No, I think it absolutely is really important to think about that. Usually in most situations where there's change, there are people who benefit and there are people who don't, and so it is important, for policymakers to be always mindful of that. And how do you minimize the effect on the losers so you don't have people who are catastrophically impacted by change, and that you also provide people with ways to adjust to change. If you're promoting policies that really hold people responsible for things they have no control over, then there's a huge fairness issue with that. I don't think that you can ever get away from the distributional effect of policies. You always have to be mindful of it. But I don't think that's. I think the opposite danger is that you never do anything, and that there are people who are very ill-served by the systems we have right now, and who are struggling, and in some cases, I don't want to be too dramatic, but there are people who are dying because of the way our healthcare system is right now, who don't need to be. And so we shouldn't forget about that as well.
Mm-hmm. I concur. Yeah, I mean, I think that you're right that we need to be mindful. I think that Brian's comments were really wise to say that, we should decide what amount of loss and win is okay, and operate within some space there. But I think the other thing to say is that, the climate for this, if there are going to be big changes, is ripe for change, as inequality has continued to increase, and we've seen like wage stagnation, and young people are sort of preparing themselves, I think, recognize and are preparing themselves to tackle not just these challenges that are so prominent in sort of the public national conversation, but also, like I mentioned earlier, environmental challenges, infrastructure is a big issue that young people talk about a lot, and recognize that this sort of suite of issues are facing us. And I think are readying themselves to prepare for all of them, like in a big sweeping changes, are like kind of preparing for that mindset and think of themselves that way. One of the quotes, we talk a lot about FDR, obviously, at the Roosevelt Institute, and one of the quotes that really resonates is that, to some generations, of some generations, much is expected. And I think that there's a sense that we recognize we have a lot to do. And we're kind of preparing ourselves to do that. So I would say that the climate is right for it now.
Good. On the left side?
Wei Wenung. The panelists already alluded to how millennials have been affected by the recession. In addition, we know that real median wages have stagnated since about the 1970s. Workers have captured a smaller and smaller share of GDP, and there's no reason to assume that this will change. The balance has all gone to capital. In addition to that, not all millennials are college educated. The college educated among us could probably just keep working longer. But we do also know that life expectancy for people without a college degree has actually declined in the last 20, 30 years. I wonder if the panelists can address millennials' ability to pay for the expanded social safety net that many of us, myself included, would like.
To pay for it specifically. Yeah, I mean, so you're right that I was speaking about the Campus Networks programs most recently, but we've also recently launched a program called Roosevelt Pipeline, specifically for young workers and non-college young people, and actually folks post-college as well. And there are other initiatives like that happening. Just to your point, there is a big donut hole in civic infrastructure right now to support those young people who didn't go to college, and to think about engaging those young people and empowering them politically, that we should just all be aware of. We aren't kind of the Kiwanis generation. People aren't joining Kiwanis clubs across the country, and so there's a real hunger for places to engage in civic conversation across the country, I would say. So one thing I think we can do to include those voices and include their perspectives on how to pay for some of these things, it's essential because some of the things that those individuals need and want aren't being vocalized, aren't part of the public narrative because they aren't engaged civically. So I think one major thing we can do is provide a platform for those voices, and we can and should, I think, be investing in that in a way that we haven't in the past. So I guess first would be to involve those people more consistently. I mentioned kind of participatory experiments that are happening across the country that are good ways of doing that, and infrastructure building to replace that Kiwanis dearth. Actually, it would be great. I'm pro-Kiwanis, so we don't have to replace them. We just need to support them. And then to your point about how to pay for some of these things, I think as more of those voices are included, we'll come up with even more interesting solutions about how to pay for some of it. I mentioned some of the solutions previously, but I think the more diverse the participants in that conversation, the better the solutions that we'll come up with ultimately, not to beat around the bush, but I guess I want to defer to those individuals for whom these programs are most beneficial.
Yeah, I mean, the questioner is right that wages and incomes have stagnated, and a big part of the reason for that has been the increase in healthcare costs. If you look at compensation has gone up, but the cash part of that has stagnated while healthcare consumes more and more and more. So in terms of ability to pay, one of the things we have to do is fix the healthcare system and fix the cost problem and the quality problem, because we're most certainly not getting what we pay for. But another issue is that I think it's not just a matter of saying, gosh, do we have a general tax increase on everyone? The Domenici-Rivlin Task Force recommended more revenues, but it recommended cleaning out a lot of deductions and saying, we don't need to provide a 35% contribution to mortgage interest for $1 million homes or even $500,000 homes. We have to make choices about what we want to fund. Which weapons programs, which tax breaks, which kinds of spending, and we have to make choices. And I think it's better to make choices that improve the system than to try and just adjust eligibility ages, which are just very disruptive and don't really solve any of the cost problems.
Okay, hi, my name is Rachel Gannon, and I know, Hilary, you've talked about how young people are very interested in maybe, taking part in this and really getting on board, but what is the narrative that we would use, or how do we frame this to really let young people understand that, this is something that they would want to get on board? Because I feel like in the past we've been able to use this more as like a value. This is a value of, we will, for example, for Medicare, you work really hard, so then you will be taken care of, or it's you will, help take care of your family at some point. But I feel like in today's age, it's not that, and so it definitely needs to be changed. I mean, I guess you would have, maybe a couple caregivers who, can't get jobs right now, so that's what they can do, but how do we reframe this to really fit this age?
Yeah. So I am excited to, in this community, this sort of group of people, one of the things that's most exciting is a lot of organizations are really trying to reach out to young people and get them involved, and that's always great to see. We love to be engaged. So I mentioned or alluded to a few different ways earlier, but things that we've seen that are really effective. Like I said, this is a community-oriented generation, so a lot of the work that young people are doing is local, like hyper-local, getting involved at the block level, the city level, that kind of thing. So to the extent that we can frame these programs as being supportive of one's local community, that's been really effective. So not talking just about Social Security as sort of a broad national program, just, in big sweeping language, but also talking about, how that program actually affects the people in your block, in your neighborhood. What does that look like? What does the impact of Social Security look like? What would the community look like if it weren't there? That kind of thing. The same thing's true with Medicare and Medicaid. You can have those conversations. So that's one, making it hyper-local. Another way that we've seen, I mentioned this before, but appealing to identities that are really salient for the millennial community is really effective. So as opposed to sort of self-serving identities, things like that, the national identity is really powerful. One's racial group identity is really powerful. Young people are an identity to politics generation. They just really have deep roots in their identity groups. So I think appealing to those has been really effective. And then the last thing I'll say is just the extent to which we can frame this more broadly. Allowing them to think about the social safety net as something that has lots of components and different parts, not just these few programs that are the foundation, but like we talked about earlier, different things like interesting, innovative state banks was one of the things that was really appealing to people, a sort of automatic stimulus response, things like that, expand different unemployment insurance, health or child care that's as part of the safety net. All of these different dimensions that people can really affect really make, I think, the conversation more accessible and appealing to the generation.
Yeah, I mean, I think the only thing I'd add is, Hilary gave a great answer, is I think personalizing things and not just about identity, but also, ask young people, how would you like the healthcare system to be better? Are there things you can do to change that? How could unemployment insurance have done more to help you find a job? And then I think encouraging young people to in their career work on some of these things. Like if you're worried, a state bank is, that's a policy option, and North Dakota has one. We don't have one in Oregon. But somebody who's interested in credit, getting out to small businesses, go try and, it's hard to get a job these days, but try and get a job at a credit union or a small community bank and get involved in that lending process and help connect small businesses with SBA loans and learn how that works. And then when you actually are there and see it, you can see what works well, what doesn't work well, what needs to be changed. You can build credibility and then get involved and work to improve things. So I think it's really important to get to both engage people personally, but then also tell them to get their hands dirty.
That's a really, really great point. I know we're out of time. I just want to say that I think we sometimes overplay the social media card. Like we think social media is like the only way to engage everyone who was born, after 1985. I think that's not true. But the analogy works. So it's not true that you should always be on social media, but it is true that I don't want to read a static web page. I expect a comment box and a like button, and I want to engage and upload my own photo and all of that, and that's true about the way you like to engage. So don't just talk to somebody. It has to be like, participatory. There need to be inputs, outputs. Doesn't have to be on social media, but I think the analogy is good.
So that's a good transition that after we finish this, they're going to announce the swag bag winners for social media, but we do have time for one more question.
Hi, I'm Daniel Marins from Social Security Works. First of all, I really liked your presentation, and I think that the idea of engaging with different messaging and also alternative models like the state banking model you're talking about are really interesting. I do think that sort of something that we're maybe tiptoeing around is the issue of just sheer political and financial power. And Brian, you talked about intergenerational warfare and the idea that sort of young people are being told, and a younger generation with, in many cases, lower career earnings, growing up in a bad economy, where old people's benefits are secure, they're being told to blame them, and maybe the older generation's being told to blame young people. And it seems pretty clear to me that that serves the interests of much wealthier, better-to-do interests that stand to benefit from pitting young people against old people, and that if you don't want to see your capital gains or your financial transactions taxed more, or you don't want to see
I don't mean to rush you, but they have 2 minutes to answer, so if you could ask the question, please.
I think that the institutional changes will require a massive organized sort of power conflict against certain particularly wealthy interests. Do you think so also, and do you think that young people would be interested in that?
I think change is really, really hard. The problems that we face would have already been solved if they were easy. And yes, there are powerful, well-financed interests on all sides who are trying to influence things. But I would submit to you that a lot of powerful, well-financed interests didn't want the Affordable Care Act to pass, and it did. And there are millions of people who are going to get insurance in January because of it. And it may not be exactly what everyone in this room wanted, but it did happen. And that's not the last chance to do anything big. There are going to be other chances. It's going to be hard. Some of it's timing. It takes persistence. And yeah, there's a lot of unfairness in the world, but that doesn't mean that change isn't possible.
Yeah, and I would say, as you know, the only counter to money is people, and we're the largest generation in American history. Let's use it. I think that more than other, on average, yeah, people are ready to do something, ready to be engaged, ready to get their hands dirty, looking for opportunities to do that in any direction, no matter what their political sort of ideological interests are. I think young people are ready to be engaged. They're really civically oriented generation ready to do that. And the other thing I'll say is that those organized interests you're talking about, one thing they lack is young people usually. So their messages don't work a lot of times. The quick example I'll give is that I sort of snuck into and attended one of these college conversations on a college campus that was very anti-social insurance, just to kind of see what was up. And it didn't work. They basically got everyone there with pizza and then opened pizza boxes, and they were all half gone. All the pizza was half gone before anyone got any. And then they said, "Your pizza's half gone." And then the young people were like, "Oh no, that's too bad." And then the conference organizers said, "And old people took it from you." And they were like, why? Were they hungry? Like, it was just weird. And then the people running the conference said, so you know what we need, and the pizza is your Social Security, so we should stop paying for it and take it away. And someone was like, oh no, we'll still eat it. Don't take the rest of it away. It's fine. You know, anyway, it was just weird and mismatched, and it didn't make sense, and they just thought, anyway. My point is, they aren't super well thought through, and they don't include young people in the planning, so, you know, the messages aren't always working. And on the other hand, yes, there are a lot of us, people counter money. I think they are ready to do it. We just need to provide the venues that are substantive, that are participatory, and they'll engage.
If everyone could join me in thanking Hilary and Brian. I believe they're going to be announcing the swag bag winners now, and then we're going to hear from our conference co-chairs.
Okay, hi everyone. The moment you've all been waiting for. So the winner of the swag bag, anybody who tweeted with the hashtag NASI 2013, will win this lovely tote bag, an umbrella with a NASI logo on it, a t-shirt with a NASI logo on it, and a really fancy pen with a NASI logo on it. So you guys are gonna be decked out in NASI. Okay, so the winner of the swag bag, oh, and also if you're not here, you can't win. So let's hope that they're here, is Rebecca Vallis. Is she here still? Rebecca? Oh, that's okay. I have an alternative, just in case. The other winner is Tetsuko Goholo. Yay! Yeah, come on.
Could I invite up our conference co-chairs now to close things out?
He's still trying to win.
Oh, I don't know. Go ahead. You can put Gene and Janet here. Yeah. Fernando's gone.
Yeah, it's just me.
Okay. So it's just Gene and Janet.
You can be Fernando.
No, it's okay. I'll be there. I don't do Fernando very well. I can speak.
Did we start? Yeah. All right, I promise I'm just going to talk for a few minutes, and I'm going to talk about Medicare and wrap up, and then I'm going to end with a question for all of you, or a call for help related to Medicare, not the evaluation of conference. That's Larry's job. So last August, when Gene and Fernando and I were working with Pam and Larry on trying to plan this conference, Larry really wanted us to focus on not just trying to put together a wonderful conference with expert panels, but we've all been to those a lot, right? And I hope you all agree this was terrific. But he wanted us to really focus on, okay, try to have an action plan here. Think of things where we could come away with a strategy. Let's not just keep talking about all the changes. And it's also clear that Medicare, I mean, the Congress is going to be dealing with fiscal issues, not only the next few months, but the next few years. And Medicare is going to be in the crosshairs. It's large, it's growing, so it's constantly going to be a target. And we know from our panels the last few days that we don't have agreement, that's not surprising, on large structural changes to the program, or even if we need large structural changes, or even what that might mean. But listening to all the panels, you did hear that there's really huge consensus, whether you represent pharma, whether you represent hospitals, whether you represent consumers, that we need to make Medicare more efficient. We just heard from our last panel, more modern. We want to increase the value for beneficiaries. And I can just give an aside for, just give an example. I've done some work with Denver Health, and it's one of the top safety net systems in the country. It serves Medicare, Medicaid, duals. Half the population is uninsured. It's been in the black for the last 10 years. It gets some of the top quality scores in the country and lowest costs. And Patty Gabeau, who just retired as CEO, says every time she turns around at Denver Health, it's a big integrated system, she goes crazy. She sees waste and inappropriate care and problems, which she's been working to fix. But she estimates that even in a terrific system like Denver Health, there's 30 to 40% waste, however you want to define it. And most analysts have extrapolated that to Medicare and our whole healthcare system. And I think you heard that focus with all of our panels. And there's amazing agreement. You know, if you stop short of trying to focus on how do we make the total changes to Medicare, but if we step back and focus on the changes that all of our panelists talk about, we need to do payment reform. And I think David's Commonwealth report and his colleagues, I mean, they estimated, and probably most of us would agree with moving away from fee-for-service more to paying for value rather than volume. And his estimates, their estimates, come up with over $1 trillion in savings. Everyone would agree that we have to make the whole experience more transparent, that none of us can make good decisions in Medicare because we don't even get data. So, and there are things we could do there. Potential incentives for beneficiaries to participate in medical homes or integrated care settings, particularly those with high healthcare needs, because we know we get better value. Increases in competitive bidding, reduction in administrative burden, all these things that all of us know all about that I don't think are as controversial as do we want to do premium support or something else. So, and quality measures. I love Jenny Chen Hansen earlier talking about when she ran ONLOC, and I visited ONLOC from when I was at GAO, and that population was so frail. And she said she had 10 quality measures, and now it's out of control. So what are the next steps? How do we take Larry's charge and come away and do something with really what we heard here and really consensus across a broad spectrum? Well, first of all, Health Affairs has agreed to publish articles on our 3 panels on Medicare, and then Larry's going to kind of do an overview, and that's a good start. But what we've been talking about, what we're thinking about, and this is my charge to all of you, is we would like to have NASI leadership, maybe working with some of the other groups around who've also been putting out reports and recommendations of steps we can take. And the question is, can we put together, how about an interim strategy for reform? You know, it's not the big scale reform, but an interim strategy, and only include those things where we could say to everyone agrees. Pharma, consumer advocates. And if we could put that together, I think we could take it to the Hill and actually have a shot at getting it enacted. And I think, you know, it's not the perfect form, it's not totally improving Medicare, but I think it would go a long ways towards reducing spending and increasing the outcomes for Medicare beneficiaries and the value in the program. So what we would like to end with is really just please send us, Larry, Pam, your suggestions of how we could move forward, maybe thinking of the strategy that I've just outlined or an alternative. You know, how do we just take away what we've heard here, the broad consensus that we have, and actually try to get these changes implemented. And I liked Hilary's comment at the last panel, if you see an open door, walk through it. So I think we have an open door. I think we should have NASI provide the leadership and kind of walk through it, and let's get some changes made in Medicare.
Well, I'm not going to try to make a presentation here at the end, but I do want to get a sense from people in the audience. I realize it's a very selected and probably biased audience if you've lasted to the end. But we tried very hard to achieve a balance in this session. I don't think in every case we did. I actually think we did pretty good. That's my bias. But I really want to get a sense from you whether you think we got there. And I know you filled out your sheets, but I'm going to ask you just real quickly for some balances. One, do people feel like we got it about right, having some stuff with 2 tracks and some stuff where they're general sessions? So just if you think it's about right, raise your hand. And if you don't raise your hand. Do you think that about came out right? I wasn't quite sure. I mean, don't be afraid to object. I don't want to feel good about it. We want to really make this right, because we tried the 2-track approach, and I have to say, at least according to Pam, we think that probably had something to do with our being able to attract more people to come as well. So if we get it right, that has implications not just for what we want to do in the policy front, but just for getting NASI to do well. So that's good. How about, we had basically about 3 types of presentations. We had sort of the discussion like we had just now with the young people, where we had sort of a general discussion. We had the formal presentations, and then we had the keynotes. So do you think we got those 3 about right, or do you think we should have had, well, let me ask you, should we have had more keynotes? Nobody says, should we have had more breakouts? Should we have had more presentation sessions? Or do you think that balance was about right? You okay with that? Okay. I promise I'll be quick here. A tougher one that's a little bit, how about did we get the right mix of panelists in terms of liberals, conservatives, and just the analytic types that are a little harder to define, you know, the actuaries and stuff like that? Do you feel like we got that balance about right? Yes? Aha, not as many hands, which means some people feel, did people feel like we had too many on the liberal side? Want to raise your hand? A couple? Sort of. How about on the conservative side? Do we have too many on the conservative side? Interesting. Okay. How about too many on the analytics side who weren't really strong enough on? Okay. How about old versus young? How about old people like me, if I can, older people, I should say old, versus younger people like Janet, or like our last panel. So people feel like we had too many older people and not enough young people? Could have had more younger people? Yeah, actually, a good mix. That's an interesting comment. And then I guess, well, the last one, which is a little harder, how about discussing the horizontal issues, which I think were, by horizontal I mean the sort of fix it, you know, forget about debating the size of the program and forget about debating progressivity, although there's the question of if you're going to make it more progressive, how you do it well. But by horizontal issues, I mean the fix it type of thing that often on the side, NASI often does really well in terms of the extra studies, the types of studies it gets finances. You know, like how do you really fix Medicare regardless of what size you want it to be or the overall system? Do you feel like we had enough discussion of what I'm calling these horizontal analytic issues vis-a-vis the vertical, which has to be the adequacy and progressivity issues? Do you think that mix was about right? Or do you yes? No. Raise your hand if no, just, all right. So that's really good for us to know. I saw some questions here, particularly saying we needed to get a few more young people. I actually feel like, I do have a last one. In the sessions, do you feel like we had enough time for discuss? There are 3 parts of that is discussion among the panelists' time to present, and the time for questions for the audience. So I'm going to separate those. Did we have too much time for presentations? Did we have too much time? Did we have too little time? This is maybe my pet peeve. Did we have too little time for a discussion among the panelists? Should we maybe had a little less presentation time by them and a little more time for interaction? How about questions from the audience? Should we have had more? Okay. So that's very helpful. I finally just want to end on just really congratulating not us, Fernando, Janet, and myself, who are getting a lot more credit than we deserve, but the extraordinary work the staff has done. I have to say, because I organize conferences myself, I cannot think of a conference that's more organized. You can't believe the sheets that the staff prepared for us. So here's what you've got to do, here's how you do it, here's your timing, here's how you keep on time, and just actually calling and actually organizing this thing. And by the way, somebody who was actually a secret staff member was Larry, who did a huge amount of this work as well. So I know I'm not going to mention all the people: Pam, Larry, Eliza Walker, Sabina Sanabi, sorry if I don't pronounce that right, Christine Kenyo, and all the rest of you who I should mention, but I'm not. Thank you so much. You guys deserve all the credit.
Okay, I have nothing particularly insightful to say. My job is to close this out and give you the list of final housekeeping items. But I want to thank everyone for coming and for being here throughout the discussion and for engaging. I think we had hoped for a dialogue. I think we got sort of there. I think we had hoped to stop talking about talking and start talking about action. I think we sort of got there. I felt like our last panel was really inspiring. It made me realize how out of touch I really am, and I'm going to have to spend some time to get more in touch. So we need to do more of these cross-generational engagement things. So we will do more of that. But thank you all, and I want to, in parting, just simply suggest that if you haven't done your evaluation forms, please do them and drop them in. And we really want to hear, thank you, Eugene, for having done a poll of our audience. This is very helpful. But we do take your feedback seriously, and we really want to incorporate your suggestions. We'll be doing another conference next year about the same time. Block out this part of your calendar. We'll fill it in. We'll tell you what it's going to be. But we will take your suggestions to heart next year in the way we construct this. Presentations from all of this activity will be available in about 1 or 2 weeks on the NASI website. I commend the NASI website to you for a lot of things. And following up from this conference, we're going to have some video of the conference discussion online as well. So if you had to step out for something, missed it, it'll be there for quite a bit of it. And of course, if you need anything else from NASI, please make a habit of visiting the NASI website, nasi.org. It's full of rich material. I want to thank our co-chairs. They really did a tremendous job throughout, from beginning to end, and have helped us to get a message, a concept through in this whole 2 days. And I'd like to once again thank our sponsors. We had fantastic sponsors this year, and many of them participated in the conference, and so we really appreciate that and hope to keep you on as strong supporters of NASI going forward. So thank you all very much, and enjoy the rest of February, now that we finally made it to February, and see you all.